After a long day at work, do you go home, pick up your child? They're so excited to see you. They fling their arms around you. You just want to give them a big kiss. It's a pretty wonderful moment. It sounds like one. But what if someone told you that you shouldn't do that you shouldn't kiss your kids? In Australia, the College of Obstetricians has released a statement last week that pregnant women should avoid kissing their children aged 3 and younger on the mouth. This is to prevent them from contracting a harmful virus known as cytomegalovirus, CMV. But how would this affect one's relationship with their toddler? What is the psychology behind kissing your children? Dr Rachel Hannam is a practicing psychologist from North Brisbane Psychologists. Rachel, thank you for your time this afternoon.
Thanks for having me.
Can we begin by how important physical contact is between a parent and their child?
Well, it's absolutely essential. You know, we know from decades of research now that a lack of physical contact, especially with babies and, young toddlers, can cause them to die. It can kill them, literally. From all the orphanage studies in war-torn countries, including Eastern Europe in the Second World War, the babies in orphanages who were receiving plenty of nutrition but no hugs, no touch, there was still like a 40%, I think, infant mortality rate in those orphanages due to lack of touch.
So what do you make as a psychologist, as a mental health medical professional, of a warning that comes again from the medical community about avoiding contact, kissing with your children if you're pregnant for fear of contracting a virus? What do you say to that?
Look, I'm not a medical doctor, so I don't really understand what this virus is, and I can't claim to have the science behind it, but it sounds to me like yet another thing for mothers to be anxious about. And I guess as a psychologist, and I work with quite a few pregnant women, that's a concern. But I mean, I imagine there's a way to balance it all and, take the middle path here.
And what we're talking about specifically relates to kissing as the transference of this CMV virus through the mouth. When we come to kissing generally with kids, I suppose it's quite an interesting question. Some people don't feel comfortable kissing their children. Maybe they weren't ever kissed.
Yeah.
What can you do to overcome that, Rachel?
If you're not comfortable having your children kiss you, is that what you mean?
Well, if you maybe didn't have love and affection displayed to you in abundance when you were younger, maybe your mum and your dad never kissed you, or at least they felt awkward doing so. Different era, different times, different sort of social expectations. If you feel uncomfortable, should you attempt to overcome that anxiety for the benefit of your child or not?
Yes, I think so. And I don't think you have to kiss them on the mouth. But absolutely, if you grew up in a fairly affectionless family of origin, all children, as far as I'm aware, when they're young, like affection. They like cuddles, they like touch, they like hand-holding, they like kissing. And if that's not what you experienced growing up, I think it's good to search out other role models, find friends and community members who can sort of demonstrate that to you, so that can become more normal, because it's probably just not normal for you to do it. But in preparing for this interview, I asked one of my colleagues at North Brisbane Psychologist about this topic. He has a 4-year-old daughter, and he said, I don't let her kiss me on the mouth because I don't want her to think that she should do that with everybody. So I just tell her to kiss me on the cheek. But she really wants to kiss me on the mouth. So it sounds like he had a bit of little bit of tension with his 4-year-old around that, but is teaching her, mummy and daddy kiss on the mouth, but, you kiss me on the cheek and I'll kiss you on the cheek. And that sounded like a good compromise to me.
It's interesting, isn't it? Because I remember very distinctly a point in my life when my father stopped displaying affection to me openly in public for fear of what people might think.
Yeah.
And I did feel a sort of rejection. I was probably about 10 or 11.
Yeah.
Is this something that you deal with in your psychological practice?
Yeah, occasionally when I'm talking to parents, I see a lot of couples and we're talking about parenting quite often. And I can understand why a dad would feel that way. But I think that's, much more about his needs for being seen, in a particular way. And it sounds like it didn't you weren't quite ready, didn't meet your needs for connection and affection.
Or maybe it wasn't communicated in the same way that your colleague was speaking with his 4-year-old daughter, that there was an absence of a conversation.
Yes.
And is that at the heart of what we're talking about, Dr. Rachel Hammond? If we're looking at displaying affection, that's physical, but we can use words to talk about affection and our presentation of that, physical or otherwise. Is that something you would encourage parents to do?
Yeah, absolutely. Absolutely. And that's what my colleague was saying to me, that he'll explain to his 4-year-old in very simple language, Mummy and Daddy kiss each other on the mouth, but kids kiss their parents on the cheek and on the forehead, and that's just how it is. And I think we mentioned that, you could tell kids about germs, in regards to the CMV virus. I think it's 3 or 4. Actually, you said children under 3. Is that what the doctors were advising? It's pretty hard with a 1 or 2-year-old to explain germs, but you can have a go. And definitely having a conversation with your child, you can do that with very simple words and simple language, from a very young age.
You're on ABC Radio, Brisbane and Gold Coast. You're joined this afternoon by Dr. Rachel Hannam. I'm Kat Feeney, and we're talking about kissing your kids. What does the research show, or maybe what should we be mindful of as parents when it comes to our child kissing other kids, modelling behaviour that maybe they've seen? As we're talking about mummy and daddy kiss on the mouth, they see that. They might do the same thing at kindy, grade 1, grade 5.
Yeah.
What do we do in those situations, Rachel?
Well, I think from a young age it's important to have conversations with children about degrees of privacy and intimacy. And it's okay to kind of start to bring up those words, even, that there are some things that are more private and some things that are more personal. And I guess kids always need that guidance and teaching. Sometimes they pick it up intuitively, but sometimes they explicitly need you to say, these are the situations where we do these things, but in these different, in these other situations, this is how we do it. It's our job as parents to teach and guide our children about, what's appropriate with different people and in different situations.
Is it stressful for parents?
Having to be so on, all the time. I think it is. Anyone who's listening who's a parent knows that if you're trying to be tuned in with your child and connected to, how they're feeling and what they're needing, that's work. Absolutely.
You're on ABC Radio, Brisbane and Gold Coast. You're joined by Dr. Rachel Hannam. We're talking about kissing and your children. Tanya has called in. Tanya's in Brisbane. And Tanya, you had a question for Rachel. Go ahead.
Yeah, I did. So I've got a daughter who's about to turn 13, and I still give her pecks on the lips occasionally. And I'm just wondering, is there some point in time when you're supposed to stop that, or is that okay to continue doing it?
That's an excellent question. What do you think, Rachel?
I would never want to say there's one rule that fits every family and every relationship. Again, as Kat said, having a conversation about, whether that's something that she still enjoys or finds comforting, or whether she feels like she's starting to get a bit too old for that. What's your sense of it, Tanya?
I don't feel that she does feel that. We're quite affectionate. She still sometimes holds my hand out in public, which is really lovely.
Aww.
I know that stops sometimes.
Yeah, that is lovely.
So we're not at that stage yet, but I did wonder sort of in the last few months about it. So yeah, that's good.
And adolescence can sometimes be a real cue to have those kinds of, questions as a parent, but also conversations with the teenagers. Would you agree, Rachel? Is adolescence a key point, really, in this relationship development?
And it's wonderful that Tanya and her daughter have a close relationship, so they can hopefully have those conversations.
Yeah. It's coming up to 5 minutes to 3. We'll be able to squeeze in another phone call if you like, 1300 222 612. You're joined by Dr. Rachel Hannam this afternoon, practicing psychologist from North Brisbane Psychologists. And we're just talking about kissing in your children after a warning was issued, advising pregnant women to be mindful of a dangerous virus that could be contracted were they to kiss, say, their 3-year-old on the mouth, and the 3-year-old was carrying that virus. So how do you go about protecting that relationship, the closeness, without putting yourself at risk, either physically or psychologically speaking? It's a really interesting conversation. social expectation comes to bear so often when we're talking about parenting and being seen to do the right thing. Rachel, what advice would you offer any parent who's maybe grappling with concerns about what society believes is the right thing to do? I mean, we're not talking about anything sinister here. We're just trying to talk about open displays of affection.
Yeah, absolutely. And every sort of cultural background will have different unwritten rules around that, and probably different friendship circles and groups within the community will have different expectations around that. I mean, what I want to say is that the parents should trust their intuition. Mm-hmm. But if they're not sure, then they would be wise to seek expert advice, professional advice, rather than their, advice from their parents-in-law or their friendship group if that doesn't quite feel right for them.
Exactly. Interesting. And we'll leave it right there. Dr. Hannam, thank you so much for your time this afternoon.
Thanks for having me.
Dr. Rachel Hannam, practicing psychologist from North Brisbane Psychologists, and you are on ABC Radio Brisbane and Gold Coast.